All right, so what causes dark circles from forming under the eyes, and what can you do to get rid of them? Almost everybody at some point in their lives starts to experience or notice these dark circles forming under their eyes. It makes them look kind of fatigued, maybe older, and it can be really concerning and frustrating. I know there are a plethora of different treatments, different eye creams, things that you can find at the store. And a lot of times people try them and then they end up coming to me in the eye clinic asking, hey, are these things even worth it? Do they work? Is there something better? And so in today's video, we're going to be breaking down what causes these dark circles to form under the eye. And then we'll break down the various treatment options, whether it be lifestyle treatments, things that you can be doing in your day-to-day life to reduce these eye bags, to also prevent them from getting worse. We'll also be talking about proven different over-the-counter products, eye creams that do work, that are shown in the literature and the research to be effective, as well as different surgical options, different procedures that your local eye care provider, dermatologist, and other plastic surgeons in your area may be able to offer you if it's something that is chronic and bothering you to that extent. So, if this is your first time here to the channel, let me introduce myself. My name is Dr. Joseph Allen. I'm a board-certified doctor of optometry. I practice here in the US. This channel, Dr. Eye Health, is a YouTube channel dedicated to helping people learn all about the eyes, vision, and helping you see your very best. If you are new here to the channel and you really value learning about the eyes and seeing your best, please hit the like button for this video and subscribe to the channel, as that will help grow the channel and help us reach more people so we can continue our mission to help more people see their very best. With all of that being said, thank you for joining us, and let's dive into the content. So what we're going to be covering today, our agenda is, first, we're going to talk about why dark circles occur in the first place and why this is such a concern. We'll then talk about the different causes of dark circles, including some talk and discussion on under eye bags. They're technically two different things, but people who develop under eye bags can develop more problems with dark circles. So they're related, but not the exact same thing, but we'll touch on that. We'll also be talking about the various treatment options, as we discussed earlier, the different lifestyle treatments. We'll talk about over-the-counter options, and then we'll talk about more advanced treatments as well. So first, why are dark circles such a concern? I have a lot of patients every single week that are coming in to ask about, like, hey, yeah, my eyes just look, I have these dark circles all the time. Is there something they can do about it? And it's not a surprise. When we look in the mirror, our eyes are a very intimate part of our body. When you look at somebody because you want to pay attention to them, you look at them in the eyes. And this is a very, we always say that the eyes are the window to the soul, right? And so if your eyes are looking fatigued, if they look tired, if they have these dark circles or swelling underneath, people are concerned about how that affects their appearance and how people may interpret that. And so it's not surprising, but I'll let you know this does affect everybody throughout the world, of all races, all genders, all skin types, and all ages. Even some young children are born with conditions where their eyes can be especially puffy, and that can accentuate the appearance of sort of these dark circles under the eyes. First, let's talk about the different types of causes to these dark circles, because understanding the different causes is going to help guide what sort of treatment options are going to be the best at helping your situation. First of all is hyperpigmentation. In the eye clinic and in the literature, we classify it into three categories. First is hyperpigmentation. So people who just simply have more pigment deposited in the skin of the eyelids themselves. Second is vascularity. Underneath the eyelids are the thinnest and most delicate skin on the body. And underneath the skin tissue is a vascular plexus within the orbit. And depending on how that vascularity has formed, if there's something that's agitating it, that's causing it to be inflamed, that can make the appearance of the dark circles worse, especially for people who are Caucasian or have lighter skin tones. They may be more apparent because of that vascularity in that skin. Then there are shadow effects. And this has to do more with how a skull may be formed if somebody has more prominent brows, but also has to do with, again, swelling or under eye bags and how the skin and the soft tissue has formed to accentuate the appearance of these shadowing effects that make dark circles a bit more apparent. Now let's go dive a little deeper into each of these sections just so everybody has a better understanding. First, for hyperpigmentation, this includes, just because of race, family, and genetic predispositions. They have found research that this is one of the strongest correlating factors, is that if you have dark under eye circles, like hyperpigmentation that runs in the family, then that is one of the most leading causes of people who have prominent under eye circles, or what's called periorbital hyperpigmentation. Then people can also acquire more hyperpigmentation of the skin. Think of sunlight getting freckles or melasma and senile plaques. This is largely due to hyperpigmentation related to inflammation. This has to do with hormones and then UV light exposure. And that's why eye doctors don't just recommend people wear sunglasses to protect their eyes or to make their eyes more comfortable in bright light, but also because UV light can damage the sensitive skin of the eyelids. And then, so wearing UV light protecting sunglasses can help slow down and prevent UV light damage and hyperpigmentation due to this. And if you're somebody who just doesn't like sunglasses, that's okay. Still wearing a wide brim hat in the sunlight is advised, because that can at least reduce the UV light exposure on the skin by at least 30%. Still keep in mind that light's going to bounce off the ground or the environment around you and then bounce up and hit you in the face. So I still recommend, if you can, sunglasses, wide brim hat. That can help prevent future issues. And then there's post-inflammatory hyperpigmentation. And I'll raise my hand as somebody who struggles with this myself. I'll even kind of zoom in to show you. Thankfully, I'm not having as much of a problem right now, but I have had a history of eczema on my face that appears right here, right in the tear trough. And so if I have a lot of inflammatory foods, if I'm really stressed out, if I've been irritating and scratching at my skin, this eczema can flare up. And this type of inflammation, especially chronically, can lead to a lichenification process where the skin becomes thicker and more leathery. And this can also contribute to kind of this hyperpigmentation effect, causing eyelids and parts of the face to appear darker. One thing I wanted to mention here is medications. In my research preparing for this lecture, I actually found that about 20% of hyperpigmentation of the skin is believed to be due to medications. This can include antibiotic use, antimalarials, antivirals, antipsychotics, chemotherapy, heavy metals, including one called prostaglandin analogs, which I know really well because in the eye care field, glaucoma, one of the first line treatments as a medication for glaucoma is to lower the eye pressure with a prostaglandin analog. Two brands, or two generic names, are latanoprost and bimatoprost. Let me know if you've ever heard of us here on the channel talk about glaucoma before, or maybe it's something that you have battled before. But latanoprost and bimatoprost, as prostaglandin analogs, are known to have a chance to cause hyperpigmentation of the skin. Otherwise, if you haven't heard of these, if you aren't familiar with glaucoma, maybe you've heard of Latisse. Latisse is a medication used to help grow the eyelashes and make them thicker and fuller. And in fact, Latisse was discovered because of glaucoma medications. They found that side effects for patients taking those eye drops caused them to have thicker, fuller lashes. And they said, you know what, let's see if we can change this and make it just for growing the eyelashes. Excuse me. So in the research, they have case reports showing that people taking these types of eye drops, including Latisse, have between a 1 to 6% chance of developing hyperpigmentation because of using this. It often takes 1 to 6 months before the hyperpigmentation shows up, but That has been shown that if you discontinue, let's say somebody uses Latisse, they start getting this pigmentation. If they stop, then it does often recover and recede on its own, but it may take several months for it to recover. Something I found very interesting. I also have been kind of promoting that we've been doing this talk for the last week, and I had a follower on Instagram message me, and my Instagram handle is the same. It's Dr. Eye Health, so please, if you ever want to follow us there. But they asked me, hey, I have kind of this darker appearance around their eyes because of glasses. And this is not surprising to me. There could be a few causes for this. This could be due to allergies, especially if somebody wears a metal glasses frame. Some metal frames, in fact, have nickel plating in them. And having nickel in there can cause an allergic reaction along the skin, whether it be on the temple, along the face, down here, certainly in the nose and behind the ear. And so if that happens to be somebody's problem, switching to a plastic frame is usually the simple answer. But if you happen to be somebody who's severely myopic, like myself, I'm about a -5, -550 of nearsightedness, and I wear contacts most of the time. But if you have thicker glasses, that can create not only a darker shadow effect on the face, depending on the lighting, but also it can create a minification effect due to the lens distortions. And so that can give this appearance that you have a sunken eyes or kind of this darker eye appearance, just due to those shadow and lens warpage effects. If you do have a higher prescription and you're concerned about that look, then look into getting glasses with a high index material, because that'll make the glasses thinner and lighter, and hopefully may be able to reduce some of that minification of appearance when you're wearing the glasses. The next is vascularity. So vascularity, this has to do again with the thin transparent skin on the tissues of the eyelids and then the vascular plexus underneath. Research has been shown that for people with more severe dark under eye circles, they tend to have more deoxygenated blood, and this can make the appearance of the blood vessels underneath more prominent. This also can be found for patients with anemia because their skin is usually a little bit more pale due to that anemia. And so again, it's kind of accentuated because of that. The reasons for decreased oxygen in the blood often has to do with just poor transfer of oxygen while they're breathing into the blood. This can be due to breathing issues like asthma, COPD. It could be due to problems with sleep apnea. Also, people with congestive heart failure and cardiac issues can also have these experiences. People who have problems with allergies and you have serious sinus congestion. Myself, this last week, I have been recovering from a bad cold. Give me 1 second. Excuse me, and thank you for understanding. But nasal congestion, because of inflammation in the nasal passages, all around our eyes are a series of nasal and sinuses. And these sinuses, because of inflammation, can also contribute to this shadowing effect through pale skin and makes these dark circles look more prominent. Which means that if you're somebody who struggles with allergies, there's a couple of different factors that can play into this, but allergies can not only cause this inflammation, but it can also cause swelling of the eyelid tissues, and that can also contribute to the appearance of these dark under eye circles. Shadow effects is next. Now, shadow effects is tough because this largely has to do with your anatomical structure of how the skull has formed, your brow. It also depends on fat tissue, fat herniation, which can change just due to age because we have ligament tissues called the septum that hold kind of all the contents of the orbit closer to the eyeball and keep everything intact. And as we age, this septum tissue becomes weaker, and then orbital fat can start to protrude and push on this septum, and that can give the appearance of these under eye bags. Same thing with just age. We get more wrinkles around the eyelids and crow's feet, and then our skin becomes much more lax, and just due to gravity, things start to hang down. And with age, we also have more often issues with fluid retention. So we definitely are battling things as we're getting older. And then some people will come into the eye clinic with these large swelling bags, not just underneath the eyes, but more underneath on the cheeks. And those are often described as festoons or malar mounds. It is possible for some children to be born with this deformity, but usually we see this in older individuals who have edema or fluid issues, fluid retention problems, oftentimes in conjunction with other systemic problems. But we'll touch on that a little bit later when we talk about surgical corrections for certain populations. I do want to review lifestyle factors. Myself, I'm always fascinated with what we can do to prevent conditions, different diseases, things that we can change in our lifestyle to better ourselves. And there's a lot of interesting things maybe you yourself have seen on the internet of different maybe influencers talking about what they can do to change and help with under eye bags. And I've always been curious, is there research, is there literature to back up these things? And so in my research, I found a couple interesting things. Number one is sleep. This has often been a telltale thing of like, hey, you have under eye bags, you just need to get better sleep. And this is something I thought once as well. And it turns out research has shown looking at severity of under eye bags and objectively looking at it by measuring how light comes off of the pigmented tissue and being able to see that sleep is actually not associated with objective severity. However, a lack of sleep is associated with a self-perceived severity. So if you are someone who's really tired, and I think this makes sense, if you wake up, you're groggy, you're tired, think of like a little kid. If they haven't had their nap that day, they are cranky. They're in a bad mood no matter what you do. It could be their birthday. They're just in a bad mood. They need sleep. And so when we're in a sleep-deprived state, we are more likely to have a bad attitude, a bad look about ourselves. We look ourselves in the mirror, we're going to be more self-critical. And so simply just getting more sleep may not only change your overall complexion, but your interpretation of how you look and your self-esteem regarding that appearance. I thought that was quite fascinating. There is some truth that facial fluid retention gets worse in the mornings, particularly for older populations over the age of 60. Again, this has to do with us laying in a supine position while we sleep, and then how fluid can kind of build up into our looser, more lax tissues as we age. In fact, after eye surgeries like blepharoplasty that is done to correct the position of the eyelids, surgeons often recommend that their patients sleep slightly at an elevation to draw fluid down from the face instead of having fluid kind of level out or rush into the facial fluid, into the facial tissues. So something to consider or think about, especially if you are over the age of 60. Stress. Stress is another one. Now this one, there is not a ton of research on this. There's a few publications, but we know that stress hormones can affect hyperpigmentation of the skin. It can affect fluid retention and fat deposits. But interestingly enough, similar to sleep, again, the studies have shown that not only is it not necessarily the stress associated with true hyperpigmentation or an objective measurement of more pigment around the eyes, but it's more associated with a subjective appearance. So we're really stressed. We may be, again, more critical about our appearance. But they also, in the research, have noted that it's difficult to differentiate between cause and effect, meaning they don't know if the stress is what's causing the appearance of the under dark circles, or if it's the fact that someone might also not be sleeping well, and then they're being self-critical, and that's driving them to be more stressed because they're worried about their appearance. So kind of chicken or the egg sort of the debate there. Either way, I still say it's best to try and reduce some of your stress, especially if you know that you are under a lot of stress at the time. Diet. Diet is another interesting one. Not a whole lot of research directly looking at dark circles under the eyes or under eye bags. However, there is documentation of pro-inflammatory diets leading to accelerated skin aging, to increased hemodynamic congestion and allergic responses, and facial swelling. And so I can even attest to myself, I try to personally eat more of a non-inflammatory or anti-inflammatory, more heavy plant Mediterranean style diet. And over the last 8 years, I've become really self-aware of how my body responds to different foods. But I'm a human and I have cheat days. In fact, let me know in the comments if you're catching us live what your like favorite cheat food is. If you want to treat yourself, you're having a tough day, you want to treat yourself to your favorite food, let me know what that is. For me, pizza is a great kind of cheat food sort of thing. Same thing with chicken wings. Those are like my top two. But I know if I've had a bad day and I decide, I'm going to order a pizza, I'll eat that. Tastes delicious, but that next day I can feel it. My skin is inflamed. The next morning I'm a little bit more groggy. In fact, my face, I've woken up and taken pictures and sent them to my friend to show them how swollen and puffy my eyelids are that next day, probably due to the large amount of calories, maybe because it's processed, and maybe because it has a lot of salt in it as well. Could be maybe the carbs. There's a lot of things to it. But I don't bash anybody for having cheat days and having favorite foods, even if they're considered junk food. We're all human, but still, it's good to be aware of how these types of foods can affect our bodies. One thing that is published in the research is vitamin B12. Turns out that people who are low in vitamin B12 or have vitamin B12 deficiency can have hyperpigmentation around their eyelids. If you're not aware of vitamin B12, it's called cobalamin. It's a water-soluble vitamin that's necessary for our cellular metabolism, but also plays a role in collagen production in our skin. Vitamin B12 in these few publications, and this publication I've cited here, a 2019 study did find for periorbital pigmentation, it had about 50 patients in it. 6 of those 50 had low vitamin B12, and 2 of those 6 specifically had anemia. Anemia due to vitamin B12 deficiency is called pernicious anemia, and it's pretty severe, and it's something we always have to be aware of in the clinic. But I found it really interesting in that study that although people were low in vitamin B12, 4 of those people who were low were asymptomatic, had no other clinical signs of anemia despite being below the threshold. And they ultimately did conclude in that study that they recommended for people who appear to the clinic because of periorbital pigmentation that they should be tested for vitamin B12 and anemia. So I'm even learning new things. Smoking. Smoking is another one. Smoking is known to change cuticle thickness of the skin, accelerate pigmentation, and just aging and skin necrosis. Again, I couldn't find any specific studies directly on the impact of smoking and periorbital hyperpigmentation, but it is something that's frequently asked and tested for in a lot of the surveys in those sort of studies. All right, let's take a moment. I'm going to get a sip of water here. Hope you guys are all having a great day and enjoying the education here. Let me know where you're watching from. I love knowing where everybody's chiming in from. This is great. I see a couple of people comment on brie cheese. Brie cheese is delicious. Chocolate peanut butter, top, absolutely. Love you guys for being here. Let's talk about treatments. Let's dive into lifestyle. We'll talk about the over-the-counter creams, and we'll talk about the different medical, surgical, and more advanced treatments as well. First, lifestyle. This is the main ones. Again, regular sleep. We talked about that there's no objective measurement, but I still think we know sleep is super important for eye health, for brain health, for us to manage so much of our body. Managing stress is also important. UV light protection, again, protecting the eyes that help prevent future problems. Hydration and diet. Hydration also may play a role because people who are excuse me, I am recovering from a cold. Hydration's interesting because there's not a huge correlation between hydration and the research on darker eye bags, but their hydration can affect our skin, the appearance of our skin, and even cause swelling and laxity. So it is important to at least be aware of your hydration. There's no real super concrete recommendations for amount of water to be drinking every day. There is general recommendations that around 3 liters of fluids a day, getting that from both drinking and eating foods, which I think is tough to measure how much fluid you're getting from food every day. But those are general thoughts. Definitely, if you are concerned you're not getting enough water, think looking at your urine. If your urine's super dark, maybe you're not getting enough fluids. Also talk to your doctor if they have any other recommendations or things that you can be doing to supplement and help with your fluid retention. And then, of course, diet, as we've mentioned. And diet, I just want to touch on a little bit. Again, pro-inflammatory diets. If you're not super aware, pro-inflammatory diets are described as having excess whole fat foods, refined cereals, fats, fruit juices, excessive amounts of red meat, processed meat, sugars, sweetened beverages, sweets, sugar, and honey. These are all been found to cause hyperinflammatory markers in the blood and the serum. And this has been associated with increased facial swelling, hemodynamic congestion, and allergic responses. Anti-inflammatory diets are typically described as having higher amounts of vegetables, fruits, nuts, seeds, and more fish content in those diets. And I did put a resource here from a publication out of Nutrients that looks specifically at diet and skin aging. And that one I liked because it is fully available. It is free to read that on your own. Instead, you don't have to pay. It's not behind a paywall or anything, in case you're just more interested and you want to learn a little bit more. As far as over-the-counter options, the first thing that most eye care providers will recommend, and what you'll see probably on a lot of social media, is doing cool compresses. You think of someone sitting in the spa with cucumbers on their eyes. That's the whole concept, is that there's a cooling effect that can help reduce the swelling of the eyelids. And because you're reducing the swelling, you reduce some of the shadow effects, and that may improve the appearance of dark circles under the eyes. I personally use a gel cooling mask that is from Optase. You can purchase these online. Some eye care providers may have them at their clinic. You may be able to find them at a local store. If you really want to be frugal, frozen bag of peas may work. Just note that if you ever use an ice pack or ice of any kind, you should never have that applied directly to the skin, because you don't want to be hurting your skin tissue. Again, the eyelids are very delicate. And don't do it for more than 15 minutes. In fact, if you go over 15 minutes, you may have a rebound effect, and the skin may, in fact, become even more puffy. So again, no more than 15 minutes. But cool compresses, great way, especially if you wake up in the morning and your face feels puffy. This is a great, easy option. Let's talk about some over-the-counter options for like eye creams. There are so many options. There's no way we could list them all here. In just another slide or two, we'll go over some specific ingredients you may want to keep a lookout for. However, the ones I have here shown, I also have links to them in the description below if you want to find them easily. But these are some of the top products that either I've used or I've talked with other eye care providers, and it's something that they often recommend or sell directly from their clinic. An easy one is the Neutrogena Hydro Boost. This one was recommended by a colleague of mine because it's fragrance-free and is generally good for people with really sensitive skin. It won't necessarily get rid of pigmentation, but it may help with the appearance of the swelling of under the eye, because it does have hyaluronic acid in it, which is good for the skin. CeraVe, I love a lot of their products personally. Again, I have some eczema on my skin, so I frequently moisturize throughout the day to help prevent the eczema from breaking out. I also just like to moisturize, but they also have eye repair cream, which can be really good if I'm having a flare-up of any kind. And they do specifically market that for not only puffiness, but also helping dark circles. Newer product to the market is from Lumify. This is the Brightening Eye Cream. And let me know if you guys have ever used any of these products before. Again, excuse me for my cough here. But let me know if you've ever used any of these before. The new one, Lumify from Bausch & Lomb, this is getting a lot of praise in the eye care community because Bausch & Lomb didn't just make any other kind of cosmetic or eye cream. They did research. They did several months, I believe it was a full 6 months of clinical research to determine and show that these are not only effective, but they're also safe for sensitive eyes and not contributing to dry eye disease. So they based it off of the top of the line research in dry eye. It was some of the best professionals in the world. And so this has been a product that I've been using and keeping with me, especially when I go to conventions where I give lectures to other doctors and I'm frequently taking photos. And those are usually long days. early mornings, long nights. And so I do bring this brightening eye cream with me and use it in those special occasions. But I know a lot of eye clinics offer that, and then it's easily found both online and at stores nationwide. Then there is this other product, Epionce. This is a brand that is a bit on the higher end of things, and I know several eye clinics that specialize in cosmetics. They specialize in just kind of like med spa, helping kind of improve the beauty of around the eyes. And this is frequently a product that's recommended. It is somewhere in the around the $50 to $60 range. But if you have tried the rest, you've tried everything else, and you want something that has a good clinical basis to reduce pigmentation, they have studies showing that within about 14 weeks, there's significant improvements. With that being said, depigmentation agents in the literature, the list goes pretty long. Again, if you look at the store, you'll find 3,000 different brands of under eye creams. The bolded content I have to the side, including caffeine, alpha-arbutin, cyanidin-3 glucoside, which is really interesting. That's a polyphenol that's getting a lot of research specifically as another supplement that might be beneficial for eye health, and maybe we'll talk about that in future videos. But dihydrochalcone, these ingredients are at least rated as being in publications as being the most significant at reducing hyperpigmentation, especially when mixed together in formulations. And so something to look out for, but otherwise all of these depigmentation agents have been shown to have some benefit at helping dark under eye circles. A couple of comments on these topical creams. One, a lot of times they may only offer temporary benefit at helping eye bags or swelling under the eye. They're not going to permanently get rid of it, but they at least can help with the swelling. A lot of these topical agents, specifically for removing pigment, it's going to take some time. It frequently takes not just like 1 week or 2 weeks, it may take 3 to 6 months of consistently using these type of products to get the pigment or dark circles that are in the skin to reduce and diminish. And so it is something where, again, you can't just try it once. You have to be consistent with it and really kind of tough it out for several months to see how it affects you. I also like to mention that because of these different ingredients, some people may have irritation, especially to the sensitive skin around the eyelids. So don't be afraid to at least try something out on another part of your skin, like on the back of your wrist, just to see how you react to it. Another ingredient that you may have seen in that previous list was retinol. Retinol is frequently in a lot of these eye creams for under eye bags. There is some debate in the eye care field around retinol. Retinol is a derivative of vitamin A, similar to a very strong oral medication called isotretinoin, or something called Accutane, previously known as Accutane. While Accutane or isotretinoin is a very strong oral form of vitamin A, that has been shown to cause damage to the meibomian glands in the eyelid, leading to significant forms of dry eye disease. Retinol, and I did a video on this several months ago, retinol containing creams, the research is not as clear. And so there are some leading thought leaders in the eye care field, in the dry eye space, who are concerned about it. But I personally have not seen too much published literature linking retinol creams directly to dry eye disease. But something to be aware of if you choose to go down that route, or if you've used retinol creams in the past and you also have dry eye, be sure to talk to your local eye care provider or dry eye specialist of their thoughts and their experiences, and if they urge you to avoid using retinol creams directly around the eyes. And then finally, we'll talk about some surgical options to be aware of. First, the most important thing to be aware of for these sort of advanced treatments, especially if you're having surgery, you're going to want to consult either a plastic surgeon in your area or a special type of eye surgeon that isn't just an ophthalmologist. They are called a oculoplastic surgeon. So they are an ophthalmologist, an eye surgeon who specializes in the eyelids and performing surgeries around the eyes. So you'll want to go one of those two directions. There are a few procedures in this list that some other eye care providers may be able to help with, including optometrists, but it depends on what they have available, what they specialize in, and where they live. The two that I did highlight here include hyaluronic acid fillers. These are primarily used and offered as an injection for people who have problems with elevation of fat and fluid around their eyelids, causing shadowing effects, like true under eye bag differences. And so they may be able to give these injections of hyaluronic fillers to smooth things out and improve the appearance. Hyaluronic acid fillers are becoming very popular, and there's a lot of published research showing great benefits of those. Blepharoplasty I have highlighted on here just to mention, because blepharoplasty is a very common surgery to do an eyelid lift. If somebody's eyelids are drooping down due to age or other factors, a blepharoplasty can fix that. Unfortunately, and usually your surgeon will mention this if you're going to go that route, blepharoplasty can sometimes expose other problems of under eye bags. So it can more or less change the appearance in a way. And so afterwards, people may have noticed more prominent under eye bags. Something just to be aware of, but again, to always talk to your oculoplastic surgeon or your plastic surgeon, whoever's doing those procedures, if you have any concerns, and what kind of options they may be able to offer if something happens to arise. Now, this is some newer things, some fascinating things that I didn't even really know about until this last year, as I've been digging more into red light and how red light can be applied for eyes and the skin around the eyes and really being beneficial. And there's a lot of kind of information and hype coming up around this. And I've been producing some videos, maybe you've seen a few, on red light and its effect on the eyes. Two procedures that eye doctors may be able to offer you of all kinds, including optometrists, are intense pulse light and red light devices. Intense pulse light and red light both remit wavelengths of light that can benefit the skin, improving collagen production, helping them improve more youthful appearance. Intense pulse light, at least in the eye care field, is more used specifically to treat meibomian gland dysfunction and dry eye. But as a side effect, you get all these other benefits for the skin. But otherwise, most eye doctors, like optometrists like myself, they won't be treating specifically using IPL to treat skin conditions specifically. Instead, you'd have to see a dermatologist for that. But it's a nice side effect when we are therapeutically treating meibomian gland dysfunction. Red light devices, in more recent publication, including one from 2023 and then recently 2024, just this last month, have had publications showing that red light therapy for dermatological reasons can benefit eye rejuvenation and helping the appearance of dark circles and eye bags due to presumably the collagen and the effect on the mitochondria in the skin. There are many different red light devices on the market that I've been investigating. I've been reaching out to different specialists, both ophthalmologists, optometrists, as well as dermatologists, my friends, about what they recommend in different products. I have put a list of at least 2 different products, more in the dermatology space, in the description below. One of them that we have here is from Celluma. That's been recommended. It is a higher price. It runs in the $700 to $1,000 range, typically for the at-home devices. There also are devices used by that brand in clinics. And then there's some other brands that are now available that are available to purchase for at-home use as well. This is one that specifically I've been testing out for eyes. There's not too many devices for red light treatments that are designed specifically around eye health. This happens to be one that I've been testing out for the last several weeks. I can't say for sure if it's specifically affecting my under dark circle appearance, because I haven't been doing it very long and I haven't really been doing the most scientific self-study on it. But I have been pretty impressed by both the eye doctors, the ophthalmologists, and all the research that are going into it specifically for eye health benefits. If it's something you're interested in, you want to look more into it, we will put some links in the description below. If you want to look into it, you can save 10%. They were very generous to give us a discount code for our viewers. So again, if interested to learn more, you can check out Arunalite. But I'm currently still doing self-research on these types of red light devices, specifically in the realm of eye health. I did want to do just a grand overview. Again, keep in mind, understanding hyperpigmentation, understanding the vascularity underneath the eyelids, and the shadow effects that all play a role into this. And in maybe your self-assessment or when you see an eye doctor, they're going to be thinking about all of these things. And as far as treating it, again, I think it's good to keep your lifestyle in check because that's going to help reduce the appearance of puffiness. It's going to help you personally feel better about yourself and your appearance. And using sunglasses and UV light protection will help prevent you from having worse hyperpigmentation of the eyelids in the future. Various over-the-counter creams, and then medical surgical options, keeping those all in mind, especially when you go see your local eye care professional. Myself, when I manage this, again, I really focus on lifestyle, trying to keep all of these things in check. Hydration is probably my biggest weakness and something I'm trying really hard recently to stay on top of, especially as I'm recovering from my cold. As far as over-the-counter creams, I personally use CeraVe. I'm not sponsored by them. This is not a sponsored thing, but I personally love CeraVe products. And then Bausch & Lomb's Lumify product I personally use. And then I've been just testing out the red light devices more recently, not just for dark circles for the benefit of my skin, but for other eye health reasons as well. So with all of that, thank you guys so much for being here. I do want to transition over to some live Q&A that we do in these live streams. This is where we take a moment and open up the live Q&A for anybody who's able to show up and ask questions. I always have to give out a medical disclaimer, and this is not just to cover myself, but really authentically, if you have a question, I cannot provide a diagnosis or treatment for you. It just would be unethical. You deserve the best eye care you can possibly get, and I know that you can only get that with a local in-person eye exam with a doctor near you. So keeping that in mind, any question you may have, I'm going to do my best to answer it in an educational way so that everybody can learn from it. If you have questions, please go ahead and start dropping them in the chat. Do me a favor, though, put some question marks in front of your question, then put some question marks after your question. It'll stand out a little bit easier for me to see it. I do also want to give a shout out to and a huge thank you to all of our channel members. Thank you so much for your support. You definitely help make this channel possible. These live streams for all of our channel members, for people who are curious and are not a member, our channel members, not only do they get to help select the topics that we cover in these different live streams, but they also get priority in these live Q&A. And as we continue into the next year, we hope to be bringing some more benefits to our channel members for all of your support. With all of that, thank you again, everybody, for joining in. Please like and subscribe this video if you are enjoying the content and find some value in it. So I see at least one question here from Salmus. Let's see. Oh, this makes me so happy. Okay, I love this. Salmano Cano. I'm sorry if I'm not pronouncing that correctly, but unrelated, but an optometry student in the US. Thank you so much for being here. It means so much. It's incredible. Really happy for you that you're pursuing your passion and your career in eye care. When refracting and can't get to 20/20 with your patient, when do you move on and start looking for other causes, pathology, etc.? This is a really good question. Thank you for asking this, and I think it'll bring some cool insight for viewers who don't work in the eye care field, just to understand what we're thinking about. Again, excuse me, and thank you for understanding my cold. I think over time, you will definitely get a feel for what you would expect someone to see. I personally love retinoscopy. For people who don't know what retinoscopy is, that's a technique that we use to look inside the eye, and we can develop a strong estimation of what somebody's glasses prescription is even without asking them better one or two. But by using retinoscopy, I already can tell what the quality of their tear film is. I can tell if they have maybe a scar on their eye, maybe keratoconus. I can tell if they have a level of cataract or something going on inside of the eye, or if they have a dull reflex of some kind. That automatically tips me off that, hey, there may be some pathology, and that'll explain why somebody can't get to 20/20. So starting there gives you a really good idea. As you've tried, maybe I think early on in your training, if you're asking someone better one, better two, and you get up to like 7 to 10 options and you're just not going anywhere, you've tried fishing for cylinder, looking for astigmatism correction, then it's probably best for you to say, hey, early on, especially in your training, let me do my best, but time is of the essence, because we don't want you to sit there and take 2 hours to do an eye exam. So then you are going to want to say, hey, let's look at other things. Let's look at the anterior surface. Is it a dry eye thing? Is it some other disease pathology? You can always go back and do the refraction at the end, or if you are lucky enough, if everything comes out normal, you can't have an explanation of why they can't see better, you can always come talk to your mentor, because we have students at our clinic too, and hopefully the doctor who's working with you is able to give you some slack, show you some techniques, see if they can help the patient achieve 20/20 better. Of course, there's a lot more we could maybe touch on in the future, but thank you so much for that question. I hope that gives you at least a little bit of insight, as well as other viewers who are just kind of curious about some insider talk about eye care. Love that question. Oh, this is great. Thank you, Barbara, so much for being here and being a member of our supporting member of the channel. Again, she mentions a little off subject. Could you please tell me about excuse me, about a new eye drop called Mibo that she had started tomorrow with Xiidra. So 2 different medications specifically for dry eye. Xiidra has been around since about 2019. Xiidra specifically helps at reducing inflammation in the tear film and on the surface of the eye. Not fully understood how it works, but it does help reduce inflammation and has been shown in clinical studies to not just help with excuse me, throat's getting dry, has been shown to not just show reduced clinical signs of dry eye, like what the doctor can tell has changed, but also symptoms of dry eye. So Xiidra can help a lot of people. It does often take at least a month of using before someone will notice a true benefit with Xiidra. Otherwise, if it feels better within the first few weeks, it's probably just the vehicle or the solution that it's the active ingredients mixed in. Mibo is pretty fascinating. I finally got some samples of it, so I'm planning on doing a full breakdown video of Mibo soon. Mibo is perfluorohexyloctane. It has actually been out for over a decade in Europe as well as in Australia, just under a different name. Mibo is think of it like a synthetic oil from your meibomian gland. So it's put into the eye up to 4 times a day, and it basically works and it's very silky. If you ever get a chance to try it, it basically acts as like a lipid coating to prevent your tears from just evaporating into the air. So I've found a lot of great uses for it for patients who have exposure issues. They don't blink very much. Maybe they're incomplete blinkers. There's a lot of different benefits I've been finding for it. I find that it doesn't cure dry eye. It doesn't fix meibomian gland dysfunction or anything like that. I haven't seen any research that says otherwise. But at least for seeing it clinically and seeing patients respond to it, a lot of people do respond that, especially if they have meibomian gland dysfunction or exposure issues, that it does give an improved feeling. And I've seen healing on the surface of the eye because of patients who have exposure and the surface of the eye starts desiccating and starts getting kind of eroded away. And by using Mibo, it adds that protection throughout the day so the eye can start healing. So I'm happy for you that you're being able to try this, that your doctors are being able to offer you these newer medications, and hopefully they really help you out. So thank you so much for asking that question. Paul, I just want to give you a shout out. Thank you. Yeah, cheat food is pizza and cheeseburgers. I agree. Both are amazing. Um, does Ivisia from Odin, the Odin the underwhelming, thank you. But does Ivisia help with both types of dry eye? I find that Ivisia does. Ivisia has a couple of different ingredients in it that really help with stabilization of the tear film, and they tend to bind really well. And so it creates a really good layer on the tear film. I don't believe it's technically classified in being a lipid tear, uh, which for a lot of people with more dramatic meibomian gland dysfunction may benefit more from a lipid-based tear. But I do find that Ivisia works well in my patients who have both aqueous deficient as well as their more evaporative forms of dry eye. So thank you. I personally have had great success with Ivisia, and I like it because it also is more affordable than a lot of the other brands out there, and is rated very high in both the US as well as in Europe. So this is an interesting question from Yari Rodriguez. Thank you for asking this question. This has to do with blue light from cell phones and other devices affecting intensity of dark circles. Excuse me again. So blue light, there is some interesting, even more recent publications on how blue light can affect our skin. There was some interesting debate a few years ago around like an influencer having a new skincare product that shielded the skin from blue light. At that time, I don't think they really knew fully how blue light was affecting the skin. I did read a recent publication shedding more light on that. Sorry for the pun. But blue light from the sun, because of how intense sunlight is, also mixed with the fact that sunlight has UV light and other factors, that is more likely to cause a bigger change to your skin. Blue light from digital devices is such a weak form of blue light, it's unlikely to contribute as strong of an effect, at least based on the research that I have read. This is a good question. I've read some on, but not fully. So it's something that I'll definitely kind of dig into and see if I can have a better answer for you. But eyesight, so it's as far as blue light from computer screens or digital screens affecting eye bags, I don't really think it's going to be a contributing factor. But as far as blue light contributing to eyesight, we have had other videos that we've talked about that, and there is new research coming out on blue light and the way it affects the eye. So I do hope to do updated videos going more in depth and really kind of settling a lot of the blue light myths, hopefully in the next few months. So thank you for that question. I hope it helps you out a little bit. Just to Tamara, thank you so much. Is there anything you can do to make your eyes look younger? Diet, creams, things that we reviewed here in this education. Hopefully these can all help you. I personally try to really focus on making sure that not only my lifestyle is doing really good, eating more of an anti-inflammatory diet. It's amazing. I even had a patient recently tell me how he really struggled with long COVID for a long time, and then he did change his diet. It took several months for him, but as he refined his diet, switching from more of a pro-inflammatory to more of an anti-inflammatory diet, his energy changed, his skin changed, and he's having a lot of positive benefits. Can't claim that for everybody, but I do think just working on yourself and then maybe trying some of the moisturizers and different creams that we've talked about maybe would help. But of course, talk to your local eye care provider, your local family physician, and see if there's anything that they would recommend, especially if you just want to avoid surgical correction or anything like that, or more advanced procedures. This is another good question about dry eye. Elizabeth A, thank you so much. She's asking about Cequa. Cequa, for those of you who haven't heard of Cequa before, Cequa is a medication. Active ingredient is the same as Restasis, which is cyclosporin. Cyclosporin A, the difference is that Restasis is at 0.5% concentration. Cequa is at 0.9%. Cequa also has some special micellular technology, which helps its penetration into the eye, so it absorbs faster and has typically better results, where Restasis takes frequently up to 6 months to see benefits, where Cequa takes as early as about 1 month to notice benefits. If you've been on a form of cyclosporin for over, if anybody's been on a form of cyclosporin for over a year, that's not unusual. You know, dry eye is really complex. I imagine that using some form of cyclosporin like Cequa is probably still helping quite a bit. But there may be more things, either other medications or other treatments or other things that can help bring the symptoms further down, right? Your threshold for symptoms for dry eye may be at a 7. Once you get over that threshold, you're really symptomatic. And hopefully medications like Cequa can get you, holding you at a 5 or 6. But if you have a flare up or something's agitating it, it could trigger over that threshold and you're having more symptoms. I have a lot of patients who have more severe cases that are on several different medications, or they have to go through in-office procedures along with medications. And then hopefully, you know, so just trying to give you kind of a perspective. So I think definitely if you're questioning if that's the right option for you, or if you need something else, definitely reach out to your local provider, whoever's treating you for your dry eyes. I hope they're able to offer you more options. So thank you for that. And then I know we don't really have much time, so I think we're going to be probably finishing up with the last few questions here. This one's from Aaron regarding myopia and special eye drops for myopia. We've been talking about myopia for this last month on the channel. Myopia is the medical term for nearsightedness. In those videos, we've talked about some eye drops to help prevent myopia or slow down myopia progression. So this is more important for young children. There's some eye drops called atropine. Atropine's been used for many decades and has been used around the world. It's been a lot of heavy research, mainly coming out of Asia, specifically on using atropine to slow down myopia progression. They don't fully understand how it works, but they know it interferes with signaling of the brain to the eye and how the eye grows its collagen and changes its growth. For young children, because of our growth period through adolescence, that's when it's most important that we catch children who are developing myopia and have them maybe start on some sort of medication or therapy to help slow it down. For most adults, once we hit past about as we get older, myopia slows down in general. Around the age of 23 to 25, most people don't continue developing myopia. There are about 10% of the population for people who can still progress after those ages. Usually, though, the research is done on children and people into their later teens with atropine eye drops. But these atropine eye drops are dosed at a very diluted dosage, usually anywhere from a 0.01% to a 0.05% or a 0.1%, with the best research right now around a 0.05% atropine solution that typically doesn't cause a large amount of dilation and a large amount of ciliary body dysfunction, or doesn't cause as much paralysis of the ciliary body, the muscle inside the eye that contributes to your ability to focus up close. So with older adults, may not have a huge benefit or solve any nearsightedness issues, but for young children, it is a potential therapy. So sorry for the long-winded answer. I know it's a lot. Definitely we'll be having some more content on myopia and myopia therapies, not just for kids, but I've had so many questions of adults wanting to know what they can do, if there's any research on things they can do to help with myopia or slow down and better understand the pathophysiology of it. So I'm going to be preparing another video on that topic. I do want to say thank you, everybody, for being here. I really can't thank you guys enough for all your support of the channel and for liking, subscribing, and doing all of those things. Stay tuned for future videos. We'll be talking more about not only under eye bags, but other different forms of treatments for cosmetic appearances of the eye, dry eyes, and a lot of other treatments in the near future. Thank you guys for all being here this evening. I will talk to you in the next episode, the next live stream. Have a great night.